Are you dealing with chronic headaches, whether they're behind the eyeball, at the side of the temple, the top of the head, or the most common one we see in our office where you feel like someone's kicked you in the back of the head and you have pressure at the base of the skull. And in doing so, you feel foggy headed and you just can't get through life quite the way that you used to be able to. If you're dealing with these types of problems and you've been from your primary care physician, and thank God for Imitrex if you have migraines because it does help, but you're actually looking to get to the root underlying cause why you're dealing with headaches. In our office, we specialize in something called upper cervical chiropractic, whose sole focus is the top of the neck on the atlas vertebra, which is the first one, which holds your head up, and C2, which is the second vertebra. These two vertebrae house a structure called the brainstem, and they're highly correlated if they're misaligned to chronic headache issues. Now, there's several reasons why. The first one I'll talk about is something called the myodural bridge. There's a sheath type covering over the spinal cord. You can look at it as kind of a sock. That's called the dura mater. And then there is a muscle in the back of the head that connects to the first vertebra and the second vertebra, and it goes at an angle, and underneath its surface there's a connective tissue that actually connects to that sheath that covers the cord, and that's why they call it the myodural bridge, because the bridge between the muscles and the spinal cord is that connective tissue. Now, what does that have to do with headaches? When you have an upper neck injury, the muscles at the base of the skull typically tend to tighten down. That's why a lot of people feel pressure at the back of the head. And when that muscle I just spoke of tightens, and that connective tissue can actually pull on the sheath-like covering on the cord, and that can cause interference to the spinal cord, which causes your body not to function quite the way it's supposed to. So this can be one of the underlying root causes of why people are suffering from chronic headaches. Now, migraines, there's many different theories out there what the underlying cause is. There's neurogenic theories and vascular theories, which are kind of connected because the nervous system controls the vascular system. But when people have a migraine, true migraines, when they get that aura and they know the headache is coming, basically what happens is when they have the aura, that is there's too much blood flow, there's a vasodilation in the brain. And then when the pounding headache comes, what happens is the body overcompensates and constricts the blood vessels in the brain, and that's where that pounding type headache comes from, where you can't even roll over in bed. So the central nervous system controls dilation and constriction and a nuclei in the cord called the vasomotor nucleus, which also, by the way, controls blood pressure. And so there is a myriad of ways the upper cervical misalignment influences the central nervous system, and there's a bunch of different pathways that can be affected. And chronic headache issues, whether they're cluster headaches, migraines, tension headaches, they're highly correlated to the upper cervical spine. So if you're someone who's come across this video and it's piqued your interest, we have an office in Sarasota, Florida. We do offer a free consultation and exam. If you're outside the Florida area, you can DM me. And if you want a brief informational consultation, we do also offer telehealth services. You can look at the link below or in my profile to schedule. Have a great day.